Good morning, Jen. Good morning, Dr. Dugan. Thank you for joining me on the Valder Beebe Show live out of Dallas, Texas. I'm so excited that you're here. I'm going to go ahead and start with you, Dr. Dugan. Tell me about this chronic myeloid leukemia. What is it? I have not heard that term before.
Yeah, no, thank you very much. Let me give you a little bit of background. So chronic myeloid leukemia is a type of blood cancer and is a disease more specifically of white blood cells, which are part of your immune system. This disease has a very specific mutation that develops within those white blood cells called the Philadelphia chromosome. Because of this mutation, the disease is very susceptible to treatment with a category of medications called the tyrosine kinase inhibitors, or TKIs for short. And that's what we're here to discuss with you today. Through our partnership with Novartis, we're looking to increase people's awareness and education about CML and its variety of treatments.
I want my audience to know that Dr. James Gugan is a hematology oncology specialist, so he comes well qualified to talk on this subject. Okay, doctor, why is it important for CML, that's the acronym for chronic myeloid leukemia, why is it important for those patients to have a treatment option that offers a lot more?
Well, I think the good news about CML is that we have this class of medicines, the TKIs, that work very well. But a majority of patients will not reach some of the benchmarks that we monitor while treating patients with CML, and so they'll need to change their therapies. And about 14% of patients that start on their initial TKI will not be able to continue it and will have to switch because of side effects that they will incur. The side effects very specific to each one of the TKIs in this class of medications. So that's why it's really important to have options that are both efficacious and tolerable.
Okay, I'm going to switch to Jen a little bit. Jen, I think you know more about this journey than you probably want to. Excuse me for taking the liberty of saying that.
Totally true, though. I agree with you.
Okay.
Sorry.
Would you give us a synopsis of your journey?
Sure. I was diagnosed with CML in 2014. For the first 8.5 years, I tried 3 different treatments, which kept me alive, but did not give me a quality of life that was even close to what I needed it to be. It was very humbling. I had to quit my job. My family had to take care of me because my side effects were so great. But then a few years ago, I switched to Scemblix, and it clearly was the right treatment for me. I'm working again. I have a great quality of life. I have good days and bad days, but I feel like my quality of life is just so much better, and it has allowed me to just live my life like I want to live my life.
I know on my show, I don't give advice, but would you like to give some inspiration to others who may be on the same kind of journey that you are on?
Sure, and I'm okay giving you advice. I know you don't, but I'm okay giving you advice because it's important. When you're dealing with medical issues, you need to be your own advocate. A lot of times we allow our doctors to just sort of downplay our symptoms that we're complaining about or just making decisions without us. And that's what happened to me in the beginning. And then I finally found a doctor. I became my own advocate, found a doctor that would actually work with me rather than just tell me what to do. And that made all the difference in the world. And it helped turn around my cancer journey. So I'm really grateful for him.
Well, that's great advice. I like that. And thank you for being here to tell your story, because there's nothing like someone who's walked the walk. I thank you so much, Jen. I'm going to go to you, Dr. Dugan. What do you, can you just talk about some more treatment options, or how do people find out about these treatment options? I know you spoke on it, but could you say it again?
Yeah, let me give you a little bit of background on this drug that we're talking about today, which is Scemblix. So this is one of the TKIs. It's also known as asciminib, and it's approved to treat both patients that are newly diagnosed and previously treated with another TKI for this pH-positive CML in chronic phase, which is the most common way that the CML presents. This particular drug was found to be more efficacious and superior in recent clinical trials. At about 48 weeks, it was really hitting those benchmarks better and more improved compared to some of the other standard of care tyrosine kinase inhibitors that were compared in the same clinical trial. So that's where this unmet need is. You know, patients can switch and they have good options. There are side effects always associated with these medications. And for this particular medication, some of the more common side effects are lowered blood counts or GI upset, or they can have a rash or increased blood pressure. Certainly, this is not an exhaustive list, but at my clinic at Novant Health, these are some of the side effects I see the most. For a more exhaustive list, patients can turn to this website, learncml.com, to get more information both about treatment options and the disease itself.
I want to thank you so very much, Dr. Dugan, and really I thank Jen for telling her story. And I want to thank you for educating my audience about what they can do to help themselves. Because in today's medical landscape, you got to be smart as the doctor. Yes. So I thank you both. Thank you both for being here on the Valder Beebe Show and making my day. Have a great day.
Thank you,
too, and we appreciate it. Thank you very much.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.